We're hoping to look at different models of providing emergency care that take advantage of the resources that we have in primary and secondary care and make maximum uses of those resources in a way that will be financially and clinically sustainable for the next 10 years.
I'm in I suppose the advantage of being not employed by the Acute Trust, and therefore I can come in with a slightly differing opinion on things, but I'm listening to all the other people around there. I look after a group of children who do access hospital facilities quite often, so I can hear from the professionals what the issues are around and what the quality issues are.
We have a lot of strengths in both primary and secondary care, and that we hope to establish a system where we collaborate and avoid hospital admissions for patients who don't need to be admitted to the Acute Trust, and that we can concentrate expertise for patients who do need a hospital admission and make sure that all the specialist services are available for those patients. We're also looking at ways that we can facilitate an early discharge for patients who come into hospital, get better quickly.
Well, it's all very much around making sure that it's a good quality of service and it's a safe service at the end of the day, because we have to make sure that there are many standards out there that we look at from the point of view of how many senior physicians, how many senior surgeons are around who can actually offer a service to make sure that the care is appropriately provided.
Well, it's absolutely vital that staff become involved. Not only are we employees of the Trust, but many of us, myself included, use those services. So let's design them so that those services reflect the services that we want for our children and their children on into the future.
Essentially, the clinical working group will come up with a series of ideas that they think may work for Worcestershire. That will then be taken through to the reference group, which will look at those ideas more closely. From there will be a process where those ideas are formulated and evaluated by colleagues in a clinical senate, and with public engagement we hope to come to a conclusion that will best serve our colleagues in primary and secondary care who are responsible for looking after patients in Worcestershire.